Hello, everyone. This is Myriam Weber, and welcome to the Asheville View. Today, I am joined with Michael Poandl, who is the Development and Communications Coordinator with WNCAP, which stands for Western North Carolina AIDS Project. Michael, thank you so much for being here today. How are you doing?
I'm doing great, Myriam. How are you?
Great. I'm so happy to have you here. I love having people on the show who always serve our community. And I love to share with our people and our viewers and listeners what's available for them out there. And we've discovered so many amazing organizations. So I'm really, really excited to add to that list with such an amazing organization that you belong to. So, Michael, tell me a little bit about WNCAP and tell me about what you do within the company.
The Western North Carolina AIDS Project was founded in 1986 by a small group of volunteers. This was during the peak of the AIDS crisis, when the mortality rate was very high. And at that time, the goal was really to provide hospice care and some comfort to people who were dying of AIDS in Western North Carolina. And this was a very different time back then. A lot of people who were suffering from HIV/AIDS, their families did not want to even see them in the hospital. There was a lot of ignorance about how HIV was spread. Wow. There were cases of, nurses leaving food at the door and not actually wanting to go into the room with the person. So even just simple things like physical touch and bringing some food and offering some companionship, that was really the focus of WNCAP's early days. Now, the good news is that over time, particularly in the late 90s, 96, 97, that time, there was a revolution in HIV medical treatment. The drugs became much better, and people started to live longer and healthier lives to a point now where a person living with HIV can take medication and become undetectable. And what that means is that the virus actually gets so low in their blood that it can't be detected by a traditional HIV test. And when that happens, they are actually physically unable to transmit HIV to another person. We call that U equals U, undetectable equals untransmittable. So as HIV/AIDS evolved, WNCAP evolved as well to a point where we're doing case management for people who are living with HIV. We also do a lot of prevention education services where we're actually going out into the community, teaching people about HIV and safer sex practices. We are connecting people with PrEP, which is a once daily pill that people can take to prevent HIV, and we're also doing advocacy and community outreach services. So our portfolio has really expanded, but our core mission is still the same, and that's to provide HIV prevention and care services throughout the region.
Wow, that's such an amazing thing that you guys do. I didn't know that it started that far back, and how much stigma and how many stereotypes were around, because there was not a lot of education on it, and people were so afraid and not really handling it right, not knowing how. Wow, it's huge. We've come a long way, that's for sure. What kind of you mentioned something about the community outreach that you guys do. What kind of community outreach do you guys do within our area?
So, it really depends. We have a prevention department made up of a couple of folks, and they'll go to all sorts of places, detention centers, substance abuse treatment centers. And then sometimes we'll table just at community events like Blue Ridge Pride or various festivals. Obviously, unfortunately, we had to cut down on a lot of that stuff during this past year when we couldn't do as much in-person engagement.
So were you
And
guys
then
hosting online events?
Yeah, we actually did. One of our prevention educators, Michael Harney, who is pretty well known in the community. He has long hair and he's worked for WNCAP for about 25 years now. And they used to call him the Rubber Man because he passed condoms around downtown Asheville, and still does, as far as I know. But he actually recorded his prevention education spiel, and we were able to beam that into different places digitally.
Right. Do you guys have, I'm a high school teacher. Do you guys do any events or any speaking events in high schools? I feel like this should start so early with the younger generations, and it would be such a great place to spread awareness and talk about what you do.
Yeah, I totally agree. I think that, one of the things we've seen in HIV over the past 20 years or so is that the epicenter has really moved from more urban areas to the rural South. North Carolina actually has one of the highest rates of HIV in the whole country. And it ties back to your point about education, because we do see a lot of southern states being hesitant to teach about sex in schools and teach about how sexually transmitted infections, including HIV, are actually spread, and teaching about things like condoms or PrEP, which can prevent those. As for WNCAP specifically, I do know that schools in our area, Buncombe County, but also I know we've talked to students all the way out in Graham County in the far west. So I believe that it's up to the individual discretion of the schools. But I also know that, one of the coalitions we're part of, which is based in Raleigh, the North Carolina AIDS Action Network, they do advocate every year with the superintendent of public education in North Carolina to continue to push those realistic sex ed policies.
What do you do when it comes to making your services equitable? We know there is a certain, again, stereotype about who gets it, who gets help, who goes out to admit that they want help. So there's always this stigma about a certain category of people who are going to ask for help, category of people who might have it and others might not. So all of this misconception and things that need to be learned. What do you guys do anything to kind of break that barrier a little bit and make sure that it's equitable and available to all, and then really helping people, push them to ask for help and push them to admit that this is something that you don't have to live with. This is something that you can actually reach out to an organization to get help. It's not just a certain color of people that might benefit of our services. How do you guys make sure that it is all equitable all across the board?
Wow, it's such a good question, and it's such an important issue, and it's definitely not something that I would say we've achieved fully. It's something that we've taken a hard look at least in the last couple of years. How can we put more intention into making our services equitable? Because you're absolutely right. For a long time, HIV/AIDS, I think, was seen as a white gay male disease. And the fact is that was never true, going all the way back to the 80s. There were always people of color. There were always women and Black people at the forefront of the movement, but their voices weren't always heard. And the truth is that now, today, people of color, African Americans, especially Black women, especially Black trans women, are unfortunately the ones who are contracting HIV at disproportionately higher rates. They're also not receiving the same level of medical care as a typical white middle-class man. So, for the HIV movement, equity isn't just, it's not just a privilege, or it's not just some extra thing that it would be nice to have. It really is integral to eliminating HIV, because we have to reach into these communities and communicate with them in a way that's culturally competent to achieve those services. So in terms of what we're doing on the ground, the first thing is at a staff level, and not just our staff, but our board and volunteers as well. We approach every single person who comes in with complete non-judgment, complete compassion. It's hard to take a step into the WNCAP office, whether you're getting tested, whether you've been recently diagnosed with HIV, whether you're there to receive some harm reduction services, some naloxone or some sterile syringes. It's not necessarily an easy road that leads to that WNCAP office. And whenever we survey our clients or the people we serve, that's always the number one thing they say, is that they feel seen and heard by us, which I think is super important, because when people feel like they're being talked down at or they're being shamed, they're not going to come back for services, even if they're free. So I think that's actually the most important thing that we do.
That's so amazing. So amazing. I like that you said everybody needs to understand that they are heard and seen. And I think representation is a huge part of it. And that's why we just have to have an open dialogue about this. That's why I always think about kids and education, is because we have a platform to always encourage the kids to ask questions. This is available. This is this is that. And yeah, I'm really excited to sharing all of this with my students. I really am. I'm really, really excited about this. Michael, walk me through the services. Like, let's say I walk in and I ask, what are the things that are available for our people? What do you guys provide? Like step by step, what are the things?
It's a good question. And there's a whole range of services. I would say, first and foremost, we provide prevention services. That includes, I've already talked a little bit about it. We distribute condoms throughout the community. We conduct prevention education sessions. We test for HIV and Hep C. And then if folks are HIV positive, we can hook them up with our case management services. Case managers are basically an advocate for the client. They help connect them with medical care first and foremost, but also things like food delivery, making sure they have adequate transportation to the grocery store, whatever else they need. Sometimes even just a person to talk about. In our region of the country, Western North Carolina, especially when you go west of Asheville, we find that a lot of people living with HIV are quite isolated, either because of stigma, homophobia, or transphobia, and also sometimes quite literally isolated because they lack transportation. So one of the most important things we do, we have a program within client services called community navigation, where you have people who have been WNCAP clients themselves and who are now transporting current clients to their various destinations. And in that way, they can connect with them more as a peer. Again, talking about, feeling seen and heard.
Yes.
So the other big thing that we do is harm reduction services. Harm reduction has always been a part of the HIV movement, because HIV can be spread through unsterile syringes from one to the other. So sometimes this includes people using syringes for things like injecting hormones or even injecting insulin. A lot of times it also comes from people injecting drugs.
Mhm.
And there is historically a very large stigma against that population.
Right. Wow.
And we find that that's very unhelpful to stopping the spread of HIV and hepatitis C.
Absolutely.
So we actually run the largest harm reduction program in Western North Carolina, where people can come into our Asheville office or our Franklin office. We also have mobile sites as far out as Robbinsville. People can turn in their unsterile syringes, receive sterile equipment, and also naloxone, which is a medication that reverses overdoses. And in that way, we can reduce the harm, not eliminate all the risks.
Right.
Using drugs is a risky behavior, but we can at least reduce the harm and reduce the spread of HIV and Hep C.
Absolutely.
So I would say those are our three core programs, and then we have several others.
Thank you, Michael. And these services are free, you mentioned.
Absolutely.
And if they get sent to a medical professional or a therapist, is that something that they have to have insurance for? Do they have to pay out of pocket, or is it all just kind of you guys help with all of that?
Yeah, we absolutely. The vast majority of our clients do not have insurance. Some may qualify for Medicaid, or some are veterans, but every person's situation is different.
Right.
And the great thing about WNCAP staff is that we will figure it out. One of our other departments is pharmacy services, and the people in that department, their sole job is to connect people with medications. Sorry, an ambulance is going by. These are very expensive medications, including PrEP, the prevention medication I mentioned. And there are all sorts of ways, from rebates to pharmaceutical discounts, and we make it work for people. Money is never an issue when it comes to helping our clients.
Okay, that's great news. That's wonderful.
Yeah.
How about volunteers? Do you guys take volunteers? Do you guys need volunteers for people out there who are trying to help? How old do they have to be? Can teenagers come and volunteer? What can you tell us about that?
Yeah, absolutely. From the very beginning, WNCAP was built on volunteers, and we still utilize volunteers a lot. We have volunteers who deliver food once or twice a month to people who are homebound. That's become even more important during the pandemic. We have an event coming up called Dine for Life.
Yes, that was my next question. Yes, I'm so excited about that.
I know, I am too. It's slightly different this year, where the volunteers that we're asking for won't be serving in person at the restaurants. It's more of a virtual role. But even so, we, in a typical year, we solicit between, 100 to 200 or even more volunteers to help on a single day. And that's not even counting the rest of the year when we have volunteers putting together, harm reduction kits. We actually have a volunteer in Franklin in Macon County. We call her Miss Betty. She is 92 years old, and she actually comes in and puts together cotton bags, which is something that makes using drugs safer. And she is actually a huge advocate for harm reduction,
so
and it's amazing.
Something you can do to help.
Yeah. You mentioned teenagers. I think any age, really, from 16 to 96, anybody would be welcome.
Oh, that's great. I'm so glad to hear that. So tell me about your event, April the 29th.
Yes, Thursday, April 29th. The event is called Dine for Life. It's a little bit of a different spin on our typical event, which is called Dining Out for Life, which has been going on for about 20 years now. We changed the name to reflect the fact that this year you can support restaurants in a variety of ways: takeout, delivery, dine-in, gift cards. For years, participating donated 20% of their sales on a single day to WNCAP. This year, because of the effect the pandemic has had on restaurants, we're not asking the restaurants for any donations or anything like that, but we still want to celebrate them. We still want people to support them. And if they can, we're asking that people give back to WNCAP as well, because demand for our services is at an all-time high because of the pandemic, and any community donations are so appreciated.
So, find information on Dine In for Life. That's on your website, right?
Visit WNCAP.org, which is WNCAP.org. If you're on social media, you can also find us on Facebook, Instagram, Twitter. And I should point out that anybody who either donates between now and April 29th, or if you don't want to donate, you can post a selfie with your life-saving takeout and tag us. Anyone who does that will be automatically entered into a raffle for 3 amazing prizes that we have. And you can check that out on
that will be the information on the website, I believe, will provide the list of restaurants that are participated in the event. And that's the 29th. So it's only one day, right, Michael?
What we're telling people is that it's always a good day to support an independent restaurant. Absolutely. They're the ones who are the backbone of this community. They're the ones that always give back to nonprofits like WNCAP. It's not really the big chains that are holding fundraisers for us. It's the small mom and pop places. And, you know, we have places from Asheville to Hendersonville, Weaverville, Silva, Highlands. So anywhere in WNC can participate.
And they're all local. I love that. Just local restaurant people, mom and pops, like you said, no big chains, because really we as a community have to take care of each other. That's what we have to do. I am so glad that we did this. I have so much respect and love for you guys, for what you do for our people. And I can't wait to participate in the event, Dine In for Life. I hope that we've covered everything. I hope that we have given a good representation to our viewers, and for them to find help and to find more information about the amazing things that you guys do at WNCAP. I was so happy to have you, Michael. So nice to meet you. And I can't wait to stay in touch to talk about presentations and talk about collaborations, and including us in your informative services as well, so that we can reach a younger generation. I will be in touch, and thank you so much. Do you want to say anything before we leave?
Well, I appreciate so much you having us, Myriam. We try any way we can to get our message out into the community. And yeah, I would just say that, we find a lot that one thing that prevents people from seeking help, whether that's getting tested or getting case management, is a certain amount of fear or maybe even shame. And I just really want to impress upon people that if you're concerned that you may have contracted HIV or Hep C, or you're HIV positive and you don't know what to do, give us a call, shoot us an email at info@wincop.org. All services are completely confidential, and they're completely free. And, nobody, we really have seen it all. We're certainly not going to judge you. And so I would just encourage everyone to reach out.
Wonderful, Michael. Thank you so much. And I can't wait to stay in touch. Thank you guys for watching. This was Myriam with the Asheville View. Take care of yourself and of each other. I will see you soon.